Today, we are going to be talking about the correlations between untreated hearing loss and dementia and Alzheimer's symptoms. We're also going to be talking about good treatment plans and communication strategies for you and your loved ones. So a little bit about myself. So I have been practicing in the New Braunfels area since 2005 and have decades-long experience with seeing patients who have cognitive or memory issues and hearing loss and matching the two together to come up with the best treatment plans possible. A lot of times our families, they really want to know, how do I communicate? What should I look out for? What are the signs? And today we're going to uncover all of that for you. We're going to talk about the big picture of hearing loss, give you some numbers and some statistics and what our U.S. population is, and how you can have more awareness in your community for that. So talking about the ear and the brain and how they marry together, because everything is connected. And then the correlations between the cognitive decline and how it relates to Alzheimer's and dementia. And then what can we do? First is understanding. So thank you for being here. Thank you for participating. We're going to have questions and answers afterwards, and can't wait to have, all of them come through to us. But understanding is the first step in then knowing how to communicate and also what solutions and treatment options there are in hearing devices. So these are the things we'll cover today. Now let's talk the big picture. We have a lot of patient population right now, and the good news is that we are continuing to live longer and longer. Again, over the last several decades, I have seen more and more centurions in the practice than I have ever seen before. And it's really fun to hear their stories and to celebrate all of their life and what's happened with them. The other population that we're also looking at is not only our seniors living longer in that quiet generation, but also our boomers coming into play in that 65 plus group. So the 65 plus group, in 2018, there were 52 million. And in a very short while, we're going to add 20 million into that population. Again, that is from both sides of the spectrum. So boomers continuing to come in, Gen Xers right behind, and our senior generation or quiet generation living longer. So there's a lot of patients out there that we're looking at to see what are some correlations in that 65 plus group with hearing loss and any sort of cognitive decline, and what we can do for early onset Alzheimer's, and also some mild hearing loss correlations. So we have known these stats and demographics for over a decade, and it's really nice to then see how longitudinal studies that are happening that show what we can do in advancements and treatment and education. Everyone is saying, how can we live longer? How can we keep up? Our seniors, there are lived through the Depression, and there are almost a have not until I have to need generation. What that means is they will put up with hearing loss much longer because they find that it's a luxury. They don't find it's a necessity. What we know about our boomer generation is boomers, they want the latest, they want to keep up. They don't want anything in their healthcare slowing them down. Again, these are generalizations, but study after study will show that these are pretty true to form. How that comes into play is that when we are looking at our boomers, we're also understanding they are a sandwich generation too. So they may have their senior parents to take care of. They may be experiencing some sort of hearing loss and some sort of memory concerns as well, even in their day and age. So we also see that boomers don't want to have hearing loss like their parents or have hearing loss like their grandparents, and trying to seek early treatment themselves versus getting treatment for their parents too. So there's a lot of different counseling and tips and tools that need to take place in order to understand the full picture. I have definitely had my boomer patient come in and say, Mom, Dad, come with me. I'm going to get my hearing screened. You should too, as kind of like that gateway acceptance. And we just understand that there is this very much a cultural and a generational challenge of making sure that you live life to the fullest and how can we make the most of a health and wellness in being in our lives. Hearing plays a total major role in all of this, and you may be questioning why. Why does hearing take place in our overall general health and wellness in life? Well, this is another statistic for you. So hearing loss is the third leading most common health problem in the United States. Health in general. It only falls behind heart disease and arthritis. That's a pretty big statistic there. And so if you're talking about wanting to keep up and wanting to lead a healthy and active lifestyle, you have to have hearing loss and hearing prevention on that radar. So 1 in 3 people between the ages of 65 and 74 have hearing loss, and nearly half of those, remember those big 72 million statistics? Half of those over 75 has some level of difficulty hearing. So that's a lot of Americans that could seek treatment and also the further prevention of more hearing loss occurring as they get later down the line. And we're going to talk a little bit about early treatment and how that's better in just a moment. So what does hearing loss have to do, again, with maintaining a healthy and long lifestyle? Well, guess what? These two things connect to this big, great organ that does so much for us, does everything for us. And so if your ears are not working, the brain really starts slowing down in all of those neural pathways and processing. So it's all connected. People think that you hear with your ears. You do not. The ears are just the messenger up to the brain. We hear and understand with our brain. So if the ears are not functioning, then the brain does not get that understanding. It does not get that clarity of words. And it's really hard for people to then continue with all of their other life activities if they can't hear the conversation. Famous quote from Helen Keller. When she was asked, if you could get one thing back, your hearing or your vision, which one would you choose? And she didn't miss a beat. She said, I would get my hearing all day long. Vision takes you away from things. Hearing takes you away from people. And I think that's a really powerful thing that she said, because with that lack of communication, with that lack of understanding words, you get further and further disassociated with people. And that's what brings us livelihood and vitality. So often in the clinic, audiologists look at different, what we call comorbidities, different things that are related to hearing loss and other health-related concerns. Today, we're only going to talk on one of these topics, and that's obviously the Alzheimer and dementia. But as you look at this graph, what you can see are there a lot of different other health concerns that do have an association with hearing loss. I just want everyone to have that awareness. There are many other health-related issues that have this direct correlation with untreated hearing loss. So how does this affect? We're going to run through a couple of things from this study that was shown. All of these that I'm showing on this screen all have associations with untreated hearing loss. These depressive symptoms that come on all have this direct correlation with increased risk for cognitive decline. The study that was done in 2013, again, with all of this decades of information that was given to us, really started putting the ties together for the AMA to look at, for other area agency on agings to look at, to say, wait a minute, hearing loss is directly correlated with all of these issues, which then lead to social isolation, more cognitive decline. I'm going to give you an example now. So many times, and let's have some spouses that are nudging each other in the room right now as I say this, but you ask what we're having for dinner, and the answer is, huh. And you ask again, what are we having for dinner? And the answer is, huh. And then you yell it at somebody. That's embarrassing the first time. Then a couple of nights later, and the same conversation ensues, and then all of a sudden it's, never mind, I don't want to ask you anymore. That may seem like an easy never mind, I don't want to ask you, but that's the first step in that disengagement. That's that first step in saying, you're not important to me because you have this disability that's not allowing us to communicate in the way that I want to communicate. It's embarrassing to miss a punchline time and time again with the boys at the coffee shop. It's embarrassing to go, I'm just going to nod through this conversation and hope that I'm nodding in the right place and shaking my head in the right place. It gets to be isolating when the grandkids come over and all of a sudden they're just not even talking to grandpa anymore because grandpa never hears what they say. We're just always going to go to grandma with things. These examples that I'm giving to you are those first steps in social isolation, causing anxiety, causing just an overall sadness because of those interpersonal relationships that are no longer there. 90% of all hearing losses are gradual in nature, meaning it doesn't just happen overnight. It's usually a 3 to 5 year process between the time that somebody detects that they might have a problem before they start seeking treatment for that problem. That's a lot of connectivity through the years that gradually goes away. I don't enjoy going to this restaurant anymore because it's just not worth it. It's too loud, it's too distracting. All of a sudden, the number of restaurants that you can go to are this many, and the number that you don't enjoy going to are large. All of these things lead to a person's mental state becoming very depressed, very isolated, lots of anxiety there, and a lot of resentment. In a moment, we're going to show all of those correlations because those are similar characteristics to those that also have Alzheimer's and cognition issues. Frank Lin did a study in 2014 that showed that adults with hearing loss score lower in non-auditory cognitive tests and appear 7 years older in testing results. That's 41% faster the rate of cognitive decline on those cognitive screening tests. That is really significant, that it's untreated hearing loss on cognitive tests that's showing such a rapid rate of decline. And obviously with that, shows a greater risk for dementia. So let's look at MRI results and actual brain activation and what is really going on. And what Lin's studies were showing is that images showed this reduced activation. Remember, I said those inner ear systems, they talk to your brain. We're really wanting to see the synapses and the activity that's happening in that auditory cortex. And there were significant studies on that gray matter and what happens when you don't have those fluid pathways going. So less gray matter in the auditory cortex via the MRI in adults with hearing loss compared to those with normal hearing. This was a very, very large study that really proved the significance. And again, this study was done in 2011. This is not new news. This is news, however, that we are really promoting and trying to get out to all of the support groups, to neurologists, to general practitioners, just to understand that we can do something to help at least slow down those pathway deteriorations. So when we look at dementia, of course, we all in this room know that it's a very much an umbrella term for many different variations. Again, Alzheimer's being the largest group, subgroup of the dementia characteristic. So when we look at that as it relates to hearing loss, in a counseling sort of way, we are looking to see both on what the family and what the patients look at as the first signs of onset of some cognition challenges, and also the first signs and onset of hearing loss challenges, and how long all of that has been going on. It's very important because as we look at a normal brain and a severely Alzheimer brain, there are going to be limited successes and outcomes if we have a long term with both cognition and hearing loss, delays. So as we look at the big picture of early onset hearing loss, early onset cognitive, we really want to see what the correlations are between when family members and patients first noticed that there might have started to be a decline in either hearing and cognition or both, and looking to see how long this has gone on before treatment started. So if we look at, by the age of 85, 33% of individuals showed signs of Alzheimer's disease, which is obviously the most common type. And then 5.5 million Americans have this. Obviously, these numbers show an increase in the rapid pace of people getting Alzheimer's disease. Now, remember those studies that I showed you a minute ago of how many people between the ages of 65 and 72 have hearing loss, and obviously 75 and beyond. So again, going back to early identification of both cognitive issues and hearing loss may help us bridge this gap and slow down both disease processes. I told you I was going to be coming to the symptoms that are similar. Look at all of these similarities. When someone has hearing loss, studies show a higher level of depression, anxiety, and social isolation. Obviously, those are the same with Alzheimer's disease. When you looked at their reduced ability to hear and understand speech, there's an ability, obviously, a disability to process the speech as well. And I want to pause on that one because many times family members are so frustrated because they don't know if their loved one didn't hear what they said, didn't understand what they said, or did they just not process what was said. And those are three very different things that can add the same level of frustration. You're just trying to communicate with someone that you love and you're trying to get the message across. But when both are there, it's really hard to differentiate between the two. This inappropriate psychosocial behavior and responses are very true in both. A lot of that has to correlate with that anxiety and depression and the fear and the isolation that happens in both of these subsets of patients. And this denial and defensiveness and negativity that goes along with hearing loss, I'm here to tell you, audiologists provide a service and a product that no one wants. No one gets excited when we say it's time for hearing aids. Everybody, jump for joy. But it's something that people desperately need. And they need it to remain in that connection. They need it to hear their grandson or their wife or the guys at coffee or around the bridge table. They need it to keep active, to keep social, to keep engaging, keeping communicating. So a lot of times patients will come to us in a very hostile way, in a very defensive way, and what's going to happen to me? This is also the same as you're going to a neurologist, as you're getting MRI scans, as people are wondering about the cognitive decline. There's a lot of similar emotions and feelings. And as caregivers, you can provide all of the, it's okay, mom, it's okay, dad, it's okay, spouse. But what needs to happen is just an understanding, an appreciation. And if you have both symptoms there, it's just going to be exacerbated. So the distrust of other motives, going back to we provide a service that everybody needs but nobody wants when they have a hearing loss, having trust in the counseling, having trust in your providers, that is the really big thing, and having a cohesive communication. We work alongside all the time with general practitioners, with neurology teams, with physical therapy teams, with memory care units. We have to have a collaborative team in order to get both treated and the communication that's needed. One point that I really want people to really hone in on and make aware is this correlation that I keep talking about between untreated hearing loss and dementia. And understanding that there is a timeline. That 3 to 5 year timeline is really crucial and important because milder hearing losses, when treated, are less likely to have onsets of dementia than moderate hearing losses. And again, the studies are there to show that direct correlation. I want you to kind of think in an analogy. If you had one of your legs in a cast for 3 years, 3 solid years, and that cast came off, those nerves it would take a really, really long time to get back up and to get running, and they may never run. Well, if you have your inner ears, let's say, in a cast and not firing and stimulating sound signals to your brain for 3 to 5 years, that process there really starts atrophying, just like your leg did in that cast. So a lot of times people think, well, the sound just goes in and there's a horn in there and the brain hears it. No, there's tiny little nerve cells in there and they need to be stimulated. So we can amplify this sound all day long. What cannot be repaired and cannot be rejuvenated are those nerve endings in your auditory pathway that send the sound from your ear to your brain. So when we see this correlation between mild hearing loss are twice as likely to develop dementia, moderate hearing loss is 3 times as likely to develop dementia, I don't want to get the scare of, oh my gosh, I have a mild hearing loss, I'm going to get dementia. What it's showing is if we can start treating the hearing loss sooner, we keep those pathways open. We keep that amazing brain organ firing, and we work together to keep you active, to keep you social. And if I haven't hounded on this enough, untreated hearing loss is the #1 biggest modifiable risk factor mid to late life that we can do something about that may impact what happens later down the line. So it's the #1 thing that you can encourage and get baselines. The earlier that we can put treatment into a patient's life, early onset, the better it's going to be in a long-term prognosis. It's better for the understanding, it's better for communication, it's even better for day-to-day processes that we can get a routine established of what to do. It's not too late. I'm never going to say it's too late to treat a hearing loss, but I will tell you in over 20 years of practicing, the sooner we can treat, the sooner we can get better hearing into someone with cognitive declines, day-to-day process, the more successful they are for 10 years, 15 years, 20 years down the line. So what can we do? What can we do to help improve the risk of cognitive decline? What can we do if someone already has hearing loss and you say, oh, is it too late for them? Absolutely not. It's never too late. It's never too late to start treating and to start knowing how to communicate. This is key, those communication strategies. Change your environment, change the behaviors, and listening to the speaker, just think about things. The best take-home message I can give to you all is if you are talking to a loved one with hearing loss, get their attention first. Hey, Bob, just say their name. Dear, whatever you call them, just say their name. Then say, we're going to the doctor today. Give them a topic. All of a sudden, their Rolodex of words becomes less if you give them a topic. And then look at them and enunciate well. Please don't yell at them. Yelling helps no one. It doesn't help you, it doesn't help them. So don't yell. Just enunciate and speak matter-of-factly. Don't speak rapidly. So let me go back to saying their name and why that's important. When you have hearing loss and when you have cognitive issues, you've lost your ability to multitask. And when I say that, listen to the TV, have a conversation, kind of be halfway concentrating on both. You lose that ability to multi-listen. So saying their name gets them off whatever they were doing. Even if they were silently reading a newspaper, it takes a few seconds to get off of this activity and onto you. So if you don't say their name and you just walk into a room, you're 2 or 3 sentences in, and then they say, huh? And you get frustrated and you have to start all over again, and here we go in that vicious cycle. If you just say their name, Bob, who cares if they hear it? It's a brain trigger to go, stop looking here or stop listening here and look over here. And then if you say a topic of conversation, we're going to the doctor today, and as you have that communication with them, if they miss part of a word, which is very common with cognition and very common with hearing loss, if they only hear ed, they think, oh, well, we're going to the doctor, so I bet she said head and not bread. So I can fill in that blank pretty easy because I know that topic of the conversation already. So do you see how all of a sudden it makes that communication much easier? And then to look at them and to enunciate well. Again, you have a loved one that has a slow time processing. You have a loved one that has fear and anxiety of missing out on an important conversation that you're dedicated to have with them and you've gotten their attention for. And so if you rapid fire talk to them, it builds up that anxiety in them, and it really makes it to where they're overthinking that communication. So just enunciate well, be sure and smile at them, and make sure and check in with them to say, did you understand what I was saying? And give them the allowance to be able to say, now let me repeat that back to you, or ask them, did you understand? Or what do you think about us going to the doctor on Thursday? Do you think that this is what we should talk about? And let them engage in that, just so you can also check in and make sure that they understood. So further in those communication strategies, and just to think about, is it does need to be a two-way street. Really engage the person, make sure that they're answering back. A lot of times if you're just getting head nods and shakes, they're just trying to get through it and really haven't processed what's going on. So really make that a two-way communication street. And also reduce the factor of competing noise. Remember the social isolation. It's okay to get someone out, but just be smart. When you're going to lunch or when you're going to dinner, go ahead and pick a booth that's more closed in, or a table off to the side. Try to get away as much competing background noise as you can. Remember, the multi-listen has gone away, so it's really challenging for them, and it can be confusing if there's a lot of background noise present. So try to create the most cohesive environment. Don't sit near a kitchen, there's too much stuff going on. Don't sit near the hostess or the front door, there's too much stuff going on and commotion. Try to pick a prime listening environment like a booth, which closes you in, or a table off to the side. There's some handouts that we're going to be giving today on good communication strategies. This is one of my favorites because this can be left if your loved one is in a memory care unit, or if they have a short-term rehab or hospitalization stay. This is a really nice slide, thing that can be put on their door, on their dresser, for any caregivers that work with them. Even if they're at home and you have multiple caregivers coming in, it's just a little reminder of what they need for good communication strategies. Because if you know how to talk to your loved one, you want everybody associated with them knowing how to communicate most effectively. So obviously, a easier communication will be with hearing aids and amplification and treatment for the hearing loss. So then we can check the block in knowing they heard me. I know they heard me. They have good prescriptive amplification on. Now I just need to make sure that they understood what was being said. Because again, that's always half the battle. Did they hear me? Did they just not understand? So good amplification is always the best solution to treat the hearing loss, and then we can focus more on the cognition and understanding and clarity. A lot of times we get asked, what are hearing aids? Are they just amplifiers? So before we end this session today, I do want to educate you on just what the latest technology and hearing devices are. There's a lot of myths out there. We're going to be around for Q&A after this, and we're happy to talk to you about any of those myths and debunk some of those myths. I want you to understand that hearing aids in today's world are all digital processors, and that doesn't mean that it's supposed to be scary and high-tech. What that means is it's more precise. It's a very prescriptive fitting that we can program into the hearing aids that are specific for that individual's hearing loss. And that's really important versus just an amplifier that turns everything up or everything down. They're microprocessors that can stream in television from a Bluetooth signal. It can stream in a FaceTime call from family and an iPad. We can do a lot of things, and again, not to put technology in a complicated mix, but to say we can customize these to what that individual person's need, regardless if they're 105, if they're 85, if they're 65, everybody's going to need a different space and technology. So they also enhance and filter different types of sound, so they're not just amplifiers. And that multifaceted, we can't listen anymore in background noise, there's a lot of improvements to help aid that in the microprocessors themselves, so that they know the difference between when a person is in a quiet room versus when they go into a dining facility, they go out to a restaurant. Those volumes and those settings can automatically be changed for the patient. They no longer have to deal with dials and buttons and knobs anymore. They're automatic processors. So again, with somebody with Alzheimer's or cognition issues, that's important that we can just daily put them on and forget about them, and the processors themselves will be able to interact with whatever environment it is to make sure that speech is at top of hand. And I cannot tell you enough how much at Estes Audiology we really counsel and promote this brain health, this daily use of devices, this good communication strategies. I joke all the time that we have another degree in marriage counseling and family counseling, because a lot of what we do is come in and remind family members how to communicate with someone with hearing loss, how to communicate with someone with cognitive decline, how to communicate with somebody that has both. And so it really is part of the overall health and wellness of a patient. And it gets their longevity, it gets their years of life just so much better in that they can communicate and understand and have an appreciation for what's around them. It's important for us in one of our counseling, and this is kind of the final take-home message for caregivers, when your loved one has a hearing loss and is in medical appointments, please ask those physicians, the nursing staff, the care staff, to address that person one-on-one, to look at them, to connect with them, because you as a caregiver will hear the entire message that's being relayed. You're asking your healthcare providers to engage with their patient. It's very important, especially as we look and empower and just kind of embrace the fact that they want to be treated. They don't want to be left alone just because they can't hear. They want that engagement. So be sure and educate all of your healthcare providers in giving that service to their patients. Thank you.